Good morning, everyone, and thank you, sir, for including me in this course. Because of the angulation, 45-degree tip scalps more readily, but it occludes less. And 15-degree tip is almost round in configuration, so it gives more occlusion than trenching. And 0-degree tip gives excellent occlusion, but no trenching capability. And ideally, 30-degree tip is perfect for trenching. During trenching, mild to moderate aspiration flow rate is sufficient, as we do not require any fallibility or occlusion during trenching. Since there is no requirement of occlusion, and we only need to remove the fine trench material during trenching, so vacuum should be minimum. And power setting depends on the hardness of the nucleus. There is a more harder, more power is required. And in soft cataract, softer energy like micropulses or torsional can be used. 1 to 1.5 millimeter tip should be exposed from the sleeve. Trenching should start just in front of the rhexis margin at 12 o'clock and stop just short of rhexis margin at the 6 o'clock, and it should not cross the rhexis margin on either side. In the harder cataract, rhexis should be trenching should be wide and long, and more energy is required. In softer cataract, the trench is short and narrow, and less energy should be used. The angle of attack, that is the angle between the phaconeedle and the anterior surface of the lens, which should be 45 degree. Otherwise, we may superficially chip the nucleus and injure the rhexis. 1/3 of the tip should be buried in the nucleus to get the perfect trenching. If we push more tip inside the nucleus, if we bury the more tip in the nucleus, we will push the nucleus to the periphery. And the same thing happens if we use less energy. The nucleus is biconvex, so it is more in the center. So during trenching, more amount of tissue should be trenched in the center position, and no energy should be wasted while coming back. More energy to be used during trenching in the center. Every time we need to focus and refocus with microscope to see clearly. And we need to remove small chips of the tissue very carefully during deep trenching. Otherwise, we may inadvertently create a hole in the periphery. While rotating, if we try to rotate the nucleus from the center of the trench, we'll get a small lever upon, and it will be very difficult to rotate the nucleus. But if we push the nucleus from the periphery part of the trench, we'll get bigger fulcrum, and the rotation will be easier. So after completing the 6 o'clock, we need to rotate the nucleus 180 degree to trench at the upper part. And sometimes we need to counterbalance the force of trenching by fixing the nucleus with a Sinskey hook. Now coming to the cracking. While cracking, we need to place two instruments at the deeper part of the trench and apply equal amount of force in the opposite direction to get it cracked. If we push an instrument in the one direction, we may create a zonular traction in the opposite direction. If we place the nucleus, if we place the instruments in the superficial part of the trench, it will be very difficult to crack, and sometimes it may not. And while cracking, the cracking should start from the peripheral part of the trench, and if it is incomplete, rotate it 180 degree and repeat this process, and we'll get completely cracked. The center is hardest, so it is very difficult to crack in the center. So we do not need a good fulcrum as well. This video demonstrates how to do a right trenching and cracking. The trenching should start in front of the rhexis margin, the 12 o'clock, and stop just short of rhexis margin at 6 o'clock. 1/3 of the tip should be engaged at a time, and the width of the phaco tunnel should be 1.5 width of the phaco needle. When one end of the trench is completed, it is rotated 180 degree to complete the trenching from the other end. And every time we need to refocus to see the things very clearly, and we need to remove the chips very carefully, otherwise we may create a hole. Sometimes we need to repeat the steps again to get a proper depth of the tunnel, a trench. And when achieved, place true instrument and apply equal amount of force at the periphery, and we'll get it crack. If it is incomplete, repeat it by rotating 180 degree, and there will be complete separation. Thank you.